Alzheimer's disease is the most common form of dementia. It causes problems with memory, thinking, and behavior. It is a progressive disease, gradually worsening over time. It typically starts with mild memory loss, but will slowly worsen over time. Normal daily tasks will become difficult, and eventually the patient will lose the ability to carry on a conversation and to interact with the environment. The most common early symptoms of Alzheimer's disease is difficulty in remembering newly learned information. Signs of Alzheimer's disease are typically more apparent to family members and loved ones than the patient themselves. It is estimated that 5.4 million Americans have Alzheimer's disease. In fact, in the time it takes us to do this interview, 2 people will have developed Alzheimer's disease. 5.2 million of these people are older than 65. 1 in 9 people older than 65 suffer from the disease. It is the 6th leading cause of death and kills more people than breast and prostate cancer combined. Aging is the major risk factor for developing Alzheimer's disease. Typically, most patients are over 65 years of age, although there is a small subset of patients which can develop Alzheimer's disease younger than that. Other major risk factors include family history, certain genes, history of serious head trauma, and cardiovascular risk factors. Although there is no cure or treatment which can stop the progression of Alzheimer's disease, there are treatments which can temporarily slow the worsening of symptoms and improve quality of life. Early diagnosis is important. Treatments tend to work better if begun early. Also, the patient will have more time to plan for the future and develop a relationship with doctors and other caregivers. Although we have a long way to go in treating Alzheimer's disease, we have come a long way in our ability to diagnose Alzheimer's disease. We can now use sophisticated imaging techniques to help in the diagnosis of Alzheimer's disease. An MRI of the brain can show early structural effects of Alzheimer's disease by showing decreased size of the areas of the brain responsible for learning and memory, called the hippocampi. It can also rule out other potentially treatable causes of dementia, such as normal pressure hydrocephalus or too much water on the brain. We also now routinely do PET imaging of the brain, which looks at the metabolic activity of the brain, with Alzheimer's patients showing decreased activity in certain areas of the brain. Some centers are now doing amyloid and tau PET. Amyloid and tau are proteins which deposit in the brains of Alzheimer's patients. We can use agents to stick to those proteins, and they will light up, which we can then image. Another tool that we can use in early diagnosis of Alzheimer's disease. Imaging will undoubtedly play a crucial role in the early diagnosis of Alzheimer's disease going forward, and hopefully will also lead to early treatment.